Welcome to Perimenopause Health. This presentation is about a type of HRT called pellets. In Europe, they're often referred to as implants, and it's a different type of treatment modality for getting your hormone replacement therapy. What we often hear in the group is women who have got their HRT from a company called bioTE, and often this pellet contains testosterone as well as estrogen. The basic concern about this type of treatment is that once it's under your skin, there aren't many doctors who will take it out again if you don't find it suitable. And the amount of hormone that is released into your body can get rather high. In terms of estrogen, this is very bad because it might make your periods very, very heavy. It might thicken your endometrium too much. That's the lining of your womb. And that, of course, is a risk for cancer. So apart from the fact you might start bleeding when you're not expecting to, it's not very healthy for your uterus. The problem with testosterone is that women generally only require a very tiny amount of testosterone. If they get too much, they can start getting problems with masculinization, which means they start getting problems with developing male characteristics. So that can be everything from unwanted facial hair to aggressive or irritable behavior. And in some cases, with a very high level of testosterone, the clitoris can become enlarged. And some of these changes can actually become permanent. So it's really something that you want to reconsider. I'm just going to read here from a book by a doctor called Ginny Mansberg, who is an Australian GP who specialises in menopause. And she has summed up the risks here. I think it's worth mentioning the hormone pellets here. It's a tiny implant of estrogen and testosterone that is inserted by one of these doctors just under the skin of the buttocks or belly. It slowly releases the two hormones into the body for around 6 months or so. This is not without risks, and while pellets used to be very popular, the drug companies who are manufacturing them pulled up stumps in 2012. The reason for this decision was that hormone levels from pellets are unpredictable and can stay high for years, even after they have been removed. They are now compounded by pharmacists without oversight in exactly the same way as all bioidentical hormones. So this is why in America it's the bHRT companies that are doing this. As we'll see in a bit, these products are not approved by the FDA. One potential risk from super high levels of hormones is tachyphylaxis, when the pellet releases its hormones too rapidly for your body. These super high estrogen doses seem to bring on an early return to hot flushes, but if we simply replace the pellets when hot flushes return, without measuring your estrogen levels, you can end up with a major problem. Experts advise that the implants should be replaced only when the estrogen levels fall in your blood. So that means that if you're doing this pellet therapy, that before you have it replaced, you should have a blood test to check what the levels of hormone are in your blood. This is an article I found on the bioTE Pellets, and this was about reporting adverse events for these drugs to the FDA. Let me just read some of it to you and comment on it as we go. As part of this work, several colleagues and I recently called attention to a particular issue associated with compounded hormones, specifically in the form of pellets. During an inspection in 2018 of bioTE Medical, our investigators uncovered information about 4,202 adverse events that had never been reported to the agency. The adverse event information our investigators found suggested compounded hormone pellets were possibly associated with endometrial cancer, prostate cancer, strokes, heart attacks, deep vein thrombosis, cellulitis, and pellet extrusion. However, because the reports lacked certain critical information, the FDA was able to attribute only a small percentage of the adverse events, 61 reports, such as pellet extrusion and cellulitis, to the use of compounded hormone pellets containing testosterone. The company that collected the adverse events did not send them to us during the 5 years they occurred between 2013 and 2018. However, in light of this discovery, the FDA is continuing to take multiple steps to help protect patients, which we wanted to highlight today in the interest of public health. Compounded bioidentical hormone replacement therapy, bHRT, products such as progesterone and testosterone are used at times instead of FDA-approved drugs for hormone replacement therapies. Some compounders market bHRT products as superior to FDA-approved drugs by making assertions that they are more natural, safer, or better for patients than FDA-approved drug products. Obviously, this article is saying that is not true. So if we just go back over the list of things that these are said to have caused, the adverse events were endometrial cancer, which is cancer of the womb or uterus, as it's more commonly called in America. Prostate cancer, that's when these are used for men, because obviously women don't have a prostate gland. Strokes, heart attacks and deep vein thrombosis, so that is blood clots. Cellulitis is an infection of the skin. I would suppose that would be around the insertion site for the pellet and pellet extrusion, which means that the pellet's coming out of where it's being put into the body, so it's working its way out. So that would probably go along with infection. So I know women can get very offended when I say to them, please don't talk about this type of therapy within the group. This is why. I genuinely believe that these products are dangerous, and that if you have used them before, you should think very hard before you have a replacement. So this is why I ask women not to discuss pellets within the group, because I just don't want to give them the oxygen of publicity. I really believe that they're dangerous. I've had some experience with the estrogen ones myself. The doctor would not remove it. I bled continually and heavily for weeks on end and had to take a lot of progesterone. They would not remove the pellet. That was before 2012, when these products were banned in most places. The company stopped making them because there were too many legal claims against them. It's only the bHRT companies that are doing them now. I really sincerely believe that you should stay away from them as much as you can. As usual, if you found this discussion interesting and informative, then click like and subscribe. Thank you for listening.